Welcome back to Open Line, talking about the Affordable Care Act. Good opportunity for you to call in and get your questions answered. Open enrollment is underway now, and it goes through December 15th. Based on some of the calls we've been getting, what do you want to hammer home to people right now?
Okay, you got to file your taxes because you're getting a big discount, which the federal government is paying on your behalf. So you got to reconcile that. You got to make sure. And if you paid, if you didn't take enough discount, you'll get it back. Otherwise, if you took too much, you'll have to pay that part back. But it also seems to me there are maybe letters that have arrived for people because when they first got the letter and first enrolled, they get an eligibility letter. And it says on that letter there may be some things you have to do, some documents you have to provide. And if you don't provide those documents in time, that's also a way in which you could lose the discount. So it sounds like there's some people who are not following up on that. So we would urge that anytime you're getting something about it's all from healthcare.gov in the mail, you need to pay close attention.
Right, that's important stuff.
It is.
Let's go to Phil. Hello, Phil? Or is it Paul? Who's on the line there? It's Phil? Okay, Phil, are you there? Are you there, Phil? Do you have a question? We may come back to Phil. All right, so we're going to put up that number again, but you want to hammer that home. And what are some other things? We have about 3 minutes left in this segment. What else do you want to hammer home?
Well, a lot of people don't know who's eligible. I mean, let me just sort of throw this out real quickly. Everybody knows if you're uninsured, you're eligible. You know, if you're working and uninsured, you're eligible. And if your employer does not offer you health insurance, you're eligible. Now, there is some income limits because we didn't close the coverage gap in Tennessee. You have to make about $12,500 on an annual basis so that you can get the discounts. So it's really important for people to sort of call and get some advice, or call us, or call the 844 number, and we can sort of walk them. We can do a lot of this over the phone. And then if need be, we can set up an appointment with them so we can sort of help them figure this out. I've done a lot of three-way calls between myself and the person needing assistance and the marketplace, the ACA marketplace, where I'm on the phone with them as they are talking to the marketplace to try to figure out what went wrong. You know, what do we need to do to sort of get things back on track? So we can help people with those things.
And those bullet points that you threw out at the very beginning about how many plans there are, go over those again.
Okay, so they're like, if you go in and sign up right now, you'll see 41 plans in Middle Tennessee, okay? There's some that are the bronze plans, which have a very high deductible. For about 80% of the people we work with, they get some discount and some reduction in those deductibles. Okay, so those are big items that can reduce the cost. Essentially, the federal government thinks that you should spend about 10% of your income on insurance and health care costs. If you're at the low income level, it drops down to 4%. So this is, you get pretty good coverage. You get very good coverage. You get a degree of coverage with the insurance depending on your income. And so that's why you need to know. So there are lots of choices. As I said earlier, that, you know, with the plans, $13,000 income, it's between $20 and $30. If it's about $19,000, it's about $50 to $80. Okay? There are variations in those. You want to look at your doctors, but you also want to pay attention to all these elements that you've got to do. It does seem complicated to some people. It's not, but you're getting a good benefit for it, and so it's worth paying attention to the letters, the filings, being sure you get somebody to help you who knows what they're talking about, and don't just assume you can calculate your income by saying, well, I make $12 an hour and I work, you know, I work full time.
Right.
What is full time? Okay, even that is an interesting question, but that may vary depending on your job. So all those things change your income. But the other thing people don't realize is they can earn a little bit of extra income just by work that might be given to them on external jobs to get to these amounts, and that's what we try and help people understand.
The other thing I would add to that is when people, if they just go into the healthcare.gov and just look at the plans, go to the marketplace and look at the plans, and they did not put in their age, there's a little tool there that people can use. If they didn't put in their age and the size of their family household and also the income, then they're not going to get a true reflection as far as what the premium and the discounts are going to be.
Right.
If they just go to the plans and look at the plans, they'll say, oh, I can't afford that.
Right.
But once you put in the other information, they'll find out it's very affordable.
The more information, the better. All right, we'll take a break. We'll come back, and we're going to talk about that number. So get ready to write down that number. We'll take a break. Be back right after this.